Ladies and gentlemen, if you pay attention to the Crisco Kid block party, you would recognize this face. You would recognize his voice because he is now a friend of the show. And welcome back to the program, Dr. Elliot Hirch.
Thank you. How you doing?
Everything is good. No complaints necessarily on my end. We're all healthy. I know a lot of families and a lot of individuals have been dealing with health issues, and I know it wasn't easy for everyone since the COVID-19 lockdowns, but since October is Breast Cancer Awareness Month, Dr. Hirsch.
Yes.
I wanted to speak to you because, yes, you're a doctor, you do cosmetic surgery. That's what we talked about last time. But when dealing with breast cancer specifically, I know a couple of years ago, it was the trend for women to have their breast removed to kind of just, if they tested positive for a gene, correct? And what they would do is have the tissue removed, and then they would undergo cosmetic surgery to kind of, get their breast or breast implants to, whether it's for self, confidence or just to feel better about themselves. What are you kind of seeing this October? Because I imagine this has got to be different than any other Breast Cancer Awareness Month before for you and for your practice.
That's a good question. And what's kind of happened with breast cancer is related to COVID. And a lot of it has to do with women coming in now who have later stage cancer than you would have expected, because with COVID, a lot of people weren't getting their mammograms done earlier. So we're seeing a lot of women now who are coming in with more delayed presentations.
And that is specifically due to the fact that women weren't able to go see the doctors in March, in April, and now it's kind of like catch up.
Exactly. There's a combination of a lot of doctors were closed or limiting the number of women who come in. And to be honest with you, the screening mammograms weren't considered to be essential. It's just like, if you have no family history, you've got no problems, it can wait a couple of months typically, but there's going to be a certain number of women who have cancer that show up on these screening mammograms. And so those women are coming in now, and we're seeing more breast cancer cases now than we were in March and April.
Wow. So I've read that 100,000 women, or maybe I'll say persons, because I know breast cancer does affect men. We'll get to that in just a little bit, but 100,000 people get mammograms every day. And
sounds about right.
We talked about, is that correct? Is that the right number?
Yeah, it's probably close. I mean, the American Society of Breast Surgeons, American Cancer Society recommend that women over 40 get a mammogram every year. So that's probably an accurate number. I mean, if you figure there's 340 million people in the US and probably half of them are women.
What is the percentage of women that don't know how to give themselves a self-examination?
I think, when you talk about how to do a self-examination, there's no like one size fits all way of doing it. And they talk about doing it in the shower and, like holding your breast a certain way. I don't know if you can kind of see here, just holding it a certain way so you can compress the different sides. Right. But it's the kind of thing though, where something is better than nothing. And so even if you're not doing it perfectly, if you're doing something, it's better than nothing.
Yeah, I'm a testicular cancer survivor, and at the first of the month, I try to check the boy. There's only one left, one nut and still balling, but I think it's still important, and it's uncomfortable to have the conversation talking to other men. But at one point, I was a huge advocate for testicular cancer checkups, because you have to. I would imagine the same way that women do. Guys are doing the same thing as well. But it can be uncomfortable. Sometimes a lot of women don't want to talk about their body, whether it's to other women or to other men. And so that's why I wanted to take this time as well to let people know that it's okay to have this conversation, because this is your health we're talking about, correct?
Yeah, absolutely. And, it's one thing about breasts is that there is no set like normal versus abnormal. And some breasts are firmer and some are softer. Some are bigger, some are smaller. We always say, especially when women come in to talk about different types of breast surgery, we always say breasts are sisters, not twins.
There you go.
It's always a little different. So bottom line is, it's not what is normal, it's what's normal for you, because everybody's a little bit different.
Right. Earlier, Dr. Hirsch, we talked about the women that if they tested positive for a certain gene, that they were is the correct term mastectomy?
Correct. Yeah. Yep.
are you still seeing, and I don't want to call it a trend, but are you seeing women being proactive with that and going to see you to have that surgery? Or was that kind of like, hey, there's actual science and you don't have to go to that extreme or take that precaution now as it was a couple of years ago?
No, it's still very much so the most common genes are the BRCA1 and the BRCA2 genes. Mm-hmm. And you got to remember though, most breast cancers are not genetic. It's something like under 10% of breast cancers are actually genetic. Wow. So most people who get breast cancer are not genetic. But if you do have a strong family history of breast cancer, like if your mom, your sister, your maternal aunts, or grandma, they will probably test you for those genes. And if you do have those genes, then the lifetime risk of breast cancer is extremely high. It's like 85% or more. And so if you do have them, and you're not quite ready to have the mastectomy and reconstruction when we put the implant in and give you a new breast, then they'll often do what we call a high risk screening protocol, where they'll screen every 6 months with a mammogram. And if there's any change, then they'll know it.
Speaking of screenings, I have Ashley right here with me. And she actually had a breast cancer scare a couple years ago.
Hi.
How's it going?
So a few years ago, I was young and had a bit of a breast cancer scare and went to the doctor. They said I should go and get a mammogram. Mm-hmm. But when I went in, they said that I was too young to get a mammogram and that I should probably do an ultrasound. So at what age should women start doing regular mammograms?
Well, so what probably happened to you, and this happens with younger women sometimes, is that the breasts are more dense. As you get older, your breasts kind of transition from being more glandular to more fatty. And so when you're young, they're typically firmer, they're more, like I said, dense and glandular. And as you get older, that becomes fat. And so it's hard for the mammogram sometimes to penetrate that fat. And so if they're looking like at one targeted area in the breast, then they may use an ultrasound, or they may use an MRI, which is a different way of just screening the breast tissue. The American Cancer Society, American Society of Breast Surgeons recommend that women over the age of 40 start getting mammograms, unless they have a strong family history or abnormality or some other reason to start doing it earlier.
Got it. Okay, that makes sense.
Yes. Yeah. Hopefully everything worked out fine for you. It was no big deal.
And I think that's a really valid question, because there's a lot of younger women who they may feel something and they're not sure exactly how to handle that situation. And there's women that are over 40 who have not been to the doctor or even had a mammogram. And as crazy or as hard to believe, I'm sure you've heard that before, but I'm running for mayor here in Phoenix, Arizona, and I've just talked to so many people in different neighborhoods across different socioeconomic neighborhoods and, whatever you want to say here, all walks of life. And it doesn't matter. I think that one thing that people have in common is it doesn't matter how much money you have. Breast cancer can happen to any woman.
Yep.
And this is why I wanted to ask you and talk to you, Dr. Hirsh, because what are some things that you think maybe cities or local government can do to help women and make sure that they get the resources or at least the availability for mammograms?
I think, the simplest thing that can be done is education. And just tell women that at the age of 40, we recommend that you start the screening process. And I can't even tell you how many patients I have who they're over 40 and you ask them, when was your last mammogram? They say, oh, yeah, maybe like 5 years ago, 10 years ago. And you're like, what? And so step one is just letting people know that, hey, this is something you should do. And then step two is making it readily available. And that's the tougher thing. But most of the time, if women go to their doctor and they ask for a mammogram, they can get that done, at least in the big city, like a reasonably timely fashion.
Got it. Well, Dr. Hirsh, I think we'll kind of close with this, but men in Breast Cancer Awareness Month. It seems like men are kind of forgotten about, but at the same time, there is a percentage of men that can contract breast cancer. How rare is that? And how do you begin to have that conversation to where men can feel comfortable giving themselves? I know you've heard the term man boobs, boobs or whatever you want to say, but
sure,
it's real, right?
Yeah. So there's two different things that you kind of touched on there. One of them is gynecomastia surgery, where men actually get breast development, and it's actually fairly common. And I can tell you, the past 2 weeks, I've done 2 cases of gynecomastia where men have actual breast tissue. And sometimes I've seen them that were just a small, like hard lump under the areola. And sometimes I've seen them where they're big and they look like female breasts. So that's just male breast development. If a male has that, typically the first step is to do some kind of screening, like an ultrasound, because for a male to have any kind of breast mass is abnormal. And so if you do that ultrasound screening, then you'll have a pretty good idea if it's cancer or just normal breast tissue. So that's kind of the first part. The second part is when a male has the breast cancer, it's actually easier to find in the male than the female because there's not as much tissue there. And so when men do have it, it's very, most of the time it's related to the gene. And men can have that gene too, the BRCA gene. And so, yeah, so if a male does have the breast cancer, they always check for the gene, and then they start checking the daughters and like the females in the family.
And so men and women can ask their doctor to have that. You call it BRCA test?
Yeah.
Yeah,
Exactly.
so you can get your BRCA test. You just have to special request that from your doctor, and they should be able to accommodate you.
Yes.
Well, there we go. Well, Dr. Hirsh, thank you so much. And if there is anyone who obviously maybe in the LA area, because I know you have clients from all over the world that go see you, but if they'd like to either schedule their mammogram or maybe see how your practice can actually help them in any areas dealing with breast or reconstructive surgery, cosmetic surgery in that area. Again, it is Breast Cancer Awareness Month, and I salute you for what you're doing. How can they get more involved with you?
Probably the easiest way to find us is on our website, which is www.hirsh plasticsurgery.com. Or you can follow us on Instagram, Hirsh Plastic Surgery, or Facebook, Hirsh Plastic Surgery.
Dr. Hirsh, thank you so much. You have a great rest of your Breast Cancer Awareness Month.
Thank you, too. And good luck on your mayoral run in Phoenix.